And so one of the things I'd like to get into is preventative maintenance of taking care of ourselves as men. We tend to treat our cars better than we do ourselves, so I'm going to kind of use that as an analogy as we get into the preventative maintenance. Again, preventative maintenance is the whole thing. I'd rather take care of you here in the office than in the emergency room. So the things we're going to talk about are kind of common sense, but I want you to apply them to yourself. In our lives, we don't have a dashboard light that tells us like your high blood pressure is here, or your cholesterol is high, or you have diabetes. That's why we need checkups to see what's going on. The things that we're going to be talking about are the silent killers, whether it's blood pressure, whether it's cholesterol, whether it's diabetes, whether it's prostate cancer or colon cancer. These don't come with engine lights, and that's what the whole idea behind a well visit is. So what do you expect at a well visit? When you go to a well visit, it is like pulling yourself into the mechanic to get checked out. You check out the outside of the car to see how it's going. So when you come in for your initial visit, we're going to be checking to see how things are going. We'll be checking your vital signs, your weight, your blood pressure, your temperature, your heart rate, your respiratory rate. So those are the basics. Then we get into a little bit more information. The apple doesn't fall far from the tree, so knowing your family history is essential when you come in to set up your own game plan. Just because we have good genetics, what we get from our parents, doesn't mean that we can't mess it up by the things we do, whether it's smoking or abusing our bodies in different ways. All these things are directed at the regular health checkup. So when you come in for a checkup after the examinations, listening to your heart, listening to your lungs and things like that, there are particular things we look at. Like we check the oil in the car, we have to put a dipstick in, check things out. We have to check the air levels, we have to check the transmission levels. Same thing here. We need to see how well your liver is working, how well your kidneys are working, how well your blood's carrying oxygen, what your PSA, your prostate specific antigen level is. And another thing is colon cancer. So let's break those down individually. So the big things of blood pressure right off the bat. By doing a simple test, we can see what your blood pressure is. The next step gets into the taking the blood. So by taking blood, we can see what your cholesterol level is and make changes accordingly. If you find that there's nothing going on, we can just continue to monitor it. We have different concerns at different times of our life, from 20 years of age, 30 years of age on up. So there's specific things we do at different times. Usually 40 is the age that we start doing it on a regular basis, but we want to have baseline labs before, so if there is something going on, we can make appropriate changes. So let's say we do the blood work. What do we do with that information? So if we get blood work for your sugar and we find it high, we can make changes. Now, regardless of what you think, doctors just don't like to throw drugs around. It's a matter of following the numbers and finding the way to treat that. So if we find your sugar is a little bit high, we may talk about diet. If there's something else that's going on, we may need to get more into drugs as well. Same thing with cholesterol. We want that cholesterol below 200. If it's 205 or 210, we can talk about diet. If it's higher, we may need to be a little more aggressive. Going on down the line, for prostate. So prostate is something we used to test on a regular basis. Now, this is in talking to your provider to see what the best thing is for you. The blood work alone isn't what we need. As we get older, the prostate tends to enlarge, and so the PSA can be elevated. By taking the blood work and doing the test to see, it's a quick test to see the size of the prostate. Is it enlarged? Is it knotty? What else is going on with it? We can make changes accordingly. The next thing would be for colon cancer, and there's a couple of different ways to deal with that. The standard still is the best way, is a colonoscopy, which involves going up the intestine and checking to see what's going on. If we find something, we can remove a polyp and make changes accordingly. Now there's some other tests. Cologuard is a very accessible test that they simply mail the kit to your house, and you can take a stool sample and we can measure it that way. So these are all preventative things for your overall health. The next step is, why do some people do better than others? Again, genetics is a big basis. So if you have two cars that come off the assembly line at the same time, why does one never need attention and the other one is always in the shop? Part of it has to do with the maintenance that's going on. So let's talk about that. At different times of our age, as I mentioned earlier, we need other things that are going on. With Prostate specifically, we used to do that all the time, every year. Now, unless you have symptoms of having to get up at night more than a couple of times to urinate, difficulty starting a stream, or still feeling like there's something in your bladder after you voided, it's really not worth it. You balance your risks for that. If you have a family history of prostate, that raises your concerns. Same thing with colon cancer. If you have these elevated concerns, those are what we need to address. On down the line, as we get older, there are other things we're concerned about. If you were a smoker, there's some tests we can do now that are low dose evaluation for your CAT scan for your lungs to see if we have any sort of lung cancer going on. Another thing of concern is abdominal aortic aneurysm, and that's another easy little test that we can do. Again, preventative maintenance. We want to take care of that tire before it's flat, before it hits the rim, and do something about it. Some guys say, hey, I know my body, I know what I feel like, so why do I need to do this? Well, you really don't know the oil levels until you open the hood and dipstick it and see what we got. Same thing with this. Those silent killers that I mentioned, let's find out what the numbers are and go from there. Final thing I want to bring up is immunizations. Immunizations are, you think, after you are a kid, I don't need those anymore. Yes, we need to continue to do things, flu shot on a regular basis. After 65, also being concerned about shingles. If we have other things going on as far as diabetes or other illnesses that affect us, we may need the shingle shots at an earlier age. Pneumovax, if you look at the death toll associated with pneumonia after 65, it significantly goes up. By doing a simple shot, we can prevent those things. So these are some basic information about preventative health. Hope that they helped. Have a great day. We at McKenzie Health are helping you stay healthy.